Hello out there in television land. Yes, it's yet another edition of It's Your Health. And
Are you sure?
You're on the right channel. Do not adjust your horizontal or vertical or contrast. It's still us.
It's still you, that's for sure.
Okay, well, you're going to notice something different here. Since the age of 6, my bride has been wearing glasses, and thanks to Dr. Bucci's skillful hands, she got her cataracts removed and no glasses. And since
after almost 70 years of glasses or contact lenses.
And since the age of 6, I've never had facial hair, but she said she likes this Yellowstone look, so I'm keeping it for now, and we'll see what happens. But getting back to basics, make sure you check with your healthcare provider before doing any of the things that we talk about or do on It's Your Health. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Who's that guy? Sitting at Cal Payne's studio with shorts on, by the way, getting my high school picture.
Good-looking young boy with lots of hair.
As we get older, we revert back to things in our childhood, I guess, and that's one of them. So what can I tell you?
Well, look how cute you are. Did you have lots of girlfriends?
No.
I bet he's lying.
But welcome back to the first segment of It's Your Health. Philip Benyo with his bride, ready to bring you up to date.
Yes. First headline. Do non-steroidal anti-inflammatory drugs prevent or delay fracture healing when used for pain management?
Great study that came out. You know, when you have pain, you take a non-steroidal, Nuprin, Advil, and the like. Of course, there's prescriptions ones as well. After 3 days, according to this study, it can inhibit the healing of fractures leading to non-union. So less is more in terms of pain management.
So you don't, what, do you take nothing?
Well, I didn't say that, but usually you would have to graduate to something else, perhaps Tylenol. Of course, we'd want to stay away from narcotic use for obvious reasons, but you can't rely on these non-steroidals too much. And we kind of knew that anyway, not so much with regards to inhibiting fracture healing, but they have renal side effects, they have side effects on your stomach. So
I have a question a lot of people out there would be asking. What do you mean when you say non-steroidal? Or whatever that word is.
Yeah, it's not Tylenol. It's in the Nuprin, Advil, Motrin family. And they also include prescription medications like Celebrex, Mobic, Naprosyn. These are non-steroidal.
And are you saying not to use those?
I didn't say not to use them. I don't think you should use them for a great deal. And according to the study, after 3 days, it could, in theory, inhibit your fracture healing.
That's amazing.
That is amazing.
Because you think you're taking something that's going to make you better. Okay, second one. What is the preferred treatment for anxiety in children?
Tough case. We throw a lot of time and effort on other medical conditions, childhood emotional anxiety, depressive disorders, very difficult. Cognitive therapy, talk therapy, seeing a specialist, questionable use of medications. It's a tough subject, needs professional help and guidance.
So you need a pediatrician at least, if not something for mental health.
Exactly.
Gotcha. Okay. When should a cervical spine injury be suspected in an athlete?
Well, they're unfortunately too common, and so if you're lying there and you're noticing that this person is not moving their arms or their legs, that's the first tip-off that there's a cervical spine injury. Whether you're conscious or not, if there's no movement in the arms or legs, that's a problem. But I think just to be on the safe side, you should assume the worst to begin with and not move that person until professional help arrives.
Okay, those were the headlines.
Yes.
You ready for something different?
We only have 30 minutes, sweetheart, but yes, go ahead.
Okay. toward comprehensive care for long COVID. 3 years into the COVID pandemic, it's still with us. As the virus evolves, it continues to pose a health threat in terms of both acute infections and reinfections.
Big problem. I'm seeing it all the time. Patients never really fully recover, maybe up to 10%. Still have COVID-like symptoms, but it can range for a variety of different issues. Brain fog, tired, weakness, fatigue, shortness of breath, not feeling well, almost fibromyalgia type of symptoms, anxiety, depression. The list goes on and on and on. Unfortunately, I can't necessarily diagnose it. There is no test for it. And worse off, it's difficult to treat because these are symptoms that just are due to the virus that may not go away. So very difficult. And some patients are even hampered by getting the vaccine. So we're really in a quandary with this, this horrible virus.
Oh my goodness. Speaking of horrible, I'm not even going to talk about that.
I know that looks horrible. It's called, as it looks, black hairy tongue.
Black hairy tongue.
It's a benign condition and is not really associated with anything else except it's cosmetic in nature. Sometimes you can just try to scrape some of those things off with a toothbrush. That's probably your best bet.
How do you get them?
I'm not sure exactly what causes it, but I think to be on the safe side, if your tongue looks like that, you ought to see a doctor, dermatologist, ear, nose, and throat person.
Dentist.
Yes, and to exclude other illnesses.
Wow, okay. I don't want to read this one, but I will.
Okay.
Physicians may retire soon. What does this mean for medicine? The double whammy of pandemic burnout and the aging of baby boomer physicians has the markings of some scary headlines. Up to 75% of healthcare workers will leave the profession within 3 years.
Right. Well, 25% of physicians are over 65, and so myself included. They're going to soon hang up their spikes. Not me, by the way. And so it's going to create a tremendous burden. If you haven't noticed already, try getting an appointment with a specialist or a healthcare provider.
Yeah.
The days of let's see you tomorrow are gone, and so it's going to be a very, very big challenge.
And it's not just let's see you. It's okay, I need 20 minutes worth of information on the phone. You have to tell me everything you've done and lived in your life, and then we'll see if we have an opening.
Yeah. Well, welcome.
That's a little exaggerated.
Welcome to the new normal.
Are you at risk of breaking a bone?
I don't believe so. I did have a DEXA scan, by the way, and osteoporosis, of course, leads almost every other illness in terms of frequency or prevalence. It goes over the fact that if you total all the people with diabetes, hypertension, and cancer, it dwarfs how many people have osteoporosis. Osteoporosis, thinning of the bone, as you can see on this chart, there's green, yellow, and red. Those are your T-scores, and next to that, you can probably see how thick or thin the bone is. You should get treatment so you don't get fractures. I kind of like Prolia, although there's a whole bunch of other things to use. Get a load of what Prolia will do in terms of reducing your fracture risk. Reduced vertebral fractures, 68%. Reduced hip fractures, 40%. And non-vertebral fractures, like, say, for example, your wrist, 20%. Get your DEXA scan, get your T-score, and get treated.
And it's important to know that it's not that easy. You can't just walk into a doctor's office and say, I want Prolia.
No, sometimes it's insurance mediated, and there are other medications. I'm not necessarily saying that's the one. I think it requires, like anything else, the right lid for your pot. Okay. And speaking of pots, we're already out of the first segment's time allotted to us. So we're going to be right back after this brief commercial message. Make sure you call our sponsors and say, hey, I heard it on It's Your Health, and better yet, utilize what their services are offering. We'll be right back.
welcome back. And the picture you see is me. I don't want to say how many years ago, but I was a college cheerleader, and you see my best friend, a dog, always a dog next to me, except for you.
And you've graduated to this mutt.
To this mutt, yes.
Scruffy one at that, right? By the way, out there in television land, if you like my wife without glasses, why don't you call and say yes? And if you like this, you can call and say whatever you want. But I've never really grown facial hair, so.
No, but he did, and I thought it looked pretty good, so I told him to keep it.
She started kissing me more. I mean, that was.
See that? You like that?
So.
Because it tickled.
You or me. Okay.
Let's continue with some.
Let's stay professional here. Okay.
Physical exercise tied to a reduction in suicide attempts.
Yeah, I'm not sure how exactly they figured that out, but exercise helps everything. Apparently it releases endorphins, which are good things for the brain. And you may be out amongst people exercising. Socialization also helps. But nevertheless, if you are having a mood disorder, exercise may be one of the keys of treatment for you. So keep that in mind.
Exercise is a treatment for everything.
It truly is. I hate it, but nevertheless, we do it.
Me too. Okay, here's the next one. Metformin linked to reduced osteoarthritis risk. Patients taking metformin for type 2 diabetes had a lower risk of developing osteoarthritis than other patients.
Yeah, it's kind of an interesting story. Metformin, of course, glucophage is used as one of the oral agents to treat diabetes. And here, lo and behold, they found that these patients who were on metformin had reduced osteoarthritis. So who'd ever thought? We obviously would not use the medicine for that, but sometimes medications, we use the side effect of the medication for a beneficial effect.
Kind of like Viagra.
Kind of like Viagra. I like what you're thinking there, kid. Good going. All right.
Okay. Poor diet causes 70% of type 2 diabetes. Poor diet accounts for most newly diagnosed type 2 diabetes cases worldwide.
Well, I don't know if that's a surprise or not. We always thought that diabetes was linked to bad genes. You had to actually pick good parents to kind of get through life. And if you had a high risk of diabetes, when we trace it back, you actually find parents or brothers or sisters who had diabetes. But in today's world, processed foods, wheat products, you know, I always say
stole what I was going to say.
We call them wicked whites. You know, the potatoes, the breads, the pastas. These are the things that are rice, complex carbohydrates. The body has difficulty bringing them and cutting them and breaking them apart. So they kind of put them on your hips and around your belly, and they say, "You deal with it." So diet is crucial to trying to stay out of the diabetic range.
Okay, here's the next one that I don't know anything about, but I'd like to learn.
Yeah, when you first look at this picture of this youngster's or oldster's hands, the one on the left side shows these pearly nodules that are sometimes painful, and that's actually gout that has deposited in the soft tissues, believe it or not. And some people think, well, gout, it usually affects the great toe, pain in the middle of the night. But if you have high uric acid levels, they can get deposited in the soft tissues and make these nodules. And fortunately, when you lower the uric acid level, which precipitates these things, you get the picture on the right, which are these hands that look remarkably closer to normal, where all these nodules have sort of melted away. And so uric acid, important for kidney stones, gout, and these type of things called tophi.
Okay. What do you need to know about inflammation in heart disease? Many people, doctors included, are still focusing on cholesterol when it comes to preventing heart disease. But the fact is, inflammation, not cholesterol, is the most significant lifestyle-driven risk factor for the developing coronary artery disease, plaque instability, and plaque rupture.
It's fascinating. You know, I always thought of our bodies as a nuclear power plant. You know, we're putting out energy. And when we have inflamed arteries, the arteries are concerned about breaking down. So the artery says to itself, well, guess what? I'm going to spackle myself. And it spackles itself with cholesterol, and you get the blockage, if you will. But it turns out the inflammatory process is the thing that sets all this off in motion. So you can have a very low bad cholesterol, but if you have high inflammatory arteries, guess what? You're going to get blockages. And the opposite is also true. If you have a high bad cholesterol, but your arteries are not inflamed, then chances are you're going to have less of a chance of blockages. So how do we measure this?
That was my question.
Good question.
Thank you.
You can use what's called a CRP, and the CRP test will tell us how much inflammation is in your body. And one of the biggest inflammatory issues that we have, of course, going back to diet, is sugar. Sugar is one of the more pro-inflammatory things for the what's called C-reactive protein. So it goes back to diet. And there are certain foods, maybe we can go over them just a little bit. The foods that we would be worried about would be the sugars, and again, the things that are, if you read labels, you'll see high fructose this. Anything that's processed and it has sugar in it is probably going to be pro-inflammatory. We talked about red meat, processed meat, saturated trans fats, added sugars, fried foods.
There's
all of
nothing
these
left to eat.
Right. That's why you got to cook by yourself. Certain foods stand out on lowering your inflammation or CRP, and get a load of this. Something not surprising: green leafy vegetables,
Yellow vegetables,
fatty fish, extra virgin olive oil, whole fruits, especially berries, pears, apples, whole grains, coffee, and tea. So, the fastest half hour in television. We're going to be right back
stretch that half hour.
after this brief commercial message. Remember, you're watching It's Your Health. Thank you, sweetheart.
Is this just a most beautiful couple? And in August, they're going to be married 49 years. I don't know which one puts up with the other one more, but they certainly have done a lot for this community. And here they are,
No doubt.
getting married.
Wow, that's beautiful. 49 years, that's a life sentence, sweetheart. I mean, don't you say so?
So's yours.
Oh, really? No wonder how I feel. All right, I think we should start with the headlines.
Okay, let's do the first one. Bad sleep cuts years off life. But guess what? Exercise may help slash risk. Experts recommend that most adults get 7 to 9 hours of sleep a night. If your patient, or you, is among the roughly 1/3 of people who sleep less or more, regular exercise may help them dodge possible long-term health consequences such as heart disease and early death. Plenty of research points to sleep and physical activity as crucial factors affecting life expectancy. Regular exercise can lengthen life, while too much or too little sleep will shorten it.
Well, you said it all. It's a yin and a yang. We're on a teeter-totter of life, so try to get moderation of both.
That's what it's saying, and here's one that's not for moderation. Salt. High intake linked to atherosclerosis, even with normal blood pressure. A high salt intake is an important risk factor even in the absence of hypertension.
Salt is poison. I'm sorry. Take it off your table. And if you start looking at labels and keep in mind that we should probably stay we should probably stay close to 4,000 milligrams of sodium per day. You can get that in one fast food meal. So 4 grams or less is going to be better. Very difficult and challenging. Salt is poison.
Got it. Osteoarthritis of the hip and knee. Can antidepressants help? Antidepressants cause more adverse effects and cause harm compared with placebo. Antidepressants provide slight and clinically unimportant pain relief.
Well, if you're in chronic pain, you're probably going to be depressed. And there was a theory that says, listen, we're going to put you on something as an antidepressant. I think the more popular one is Cymbalta, so that you're less depressed and you'll have less pain. It works to a large degree, especially if you're depressed. But the study is just saying, listen, maybe we ought to just try to treat the osteoarthritis and not complicate your life with another medication.
Oh, here's one I like. A cruciferous vegetable with crucial nutrition. Cooked or raw, broccoli offers health benefits, including many vitamins and minerals, fiber, and antioxidants. So we can go from there. It's a good source of potassium, phosphorus, folate, and other B vitamins, beta-carotene, magnesium, manganese, and zinc, and also contains some protein and calcium. Whew.
Keep on going.
Oh, I think.
It's a great source of fiber, correct? It's supposed to improve your immune system and decrease inflammation. Remember, we talked about that before.
It helps protect against cardiovascular disease, which is a leading cause of death, even ahead of cancer in the United States.
Broccoli may prevent cancer, you mentioned that already, and the antioxidants may help you slow down the aging process,
And
correct?
finally, it may slow the aging process. What do you know? I think I just heard
I
that.
think there's an echo in here, Sammy. And of course, because it's anti-inflammatory, I know that sounds backwards, it may lower your risk of diabetes, correct?
This one, a perfect storm. An unseasonably early RSV, whatever that means, annual epidemic, a severe annual flu epidemic, and a smoldering COVID-19 pandemic.
RSV, respiratory syncytial virus, we routinely test for that now if you come in with what we think is a viral process. So it's a trifecta this fall that we're very worried about. RSV, flu, and COVID. I don't even want to think about it.
Wow.
So,
You'll never be home.
well, hopefully I won't be in the hospital.
Yeah, hopefully. Okay, here's something else.
Speaking of viruses, keep in mind if you had chickenpox, you're at risk for shingles, and it's not too young to vaccinate. It's 50 years or older. Try to go to the pharmacy and see if you can get the Shingrix shot for herpetic zoster.
Okay, this one has to do with pre-diabetes diagnosis and management.
Pre-diabetes epidemic in this nation at this point. And in the olden days, we used to ask you to drink sugar and measure your sugar in 2 hours. If it was elevated, then you had pre-diabetes. Today, we use the hemoglobin A1C. Recall that it's the average blood sugar over a 3-month period of time. If your hemoglobin A1C is 6.5 or greater, you're diabetic. If it's less, then you're considered pre-diabetic. Diet and weight loss is one of the things that you should consider. We used to use metformin in the past, but I'm not so sure it really helps to a great deal. But nevertheless, get checked for pre-diabetes because chances are out there in television land, you got it.
Sneaky issues wrecking your libido. Just can't get in the mood? Before you blame your low libido on menopause, take a look at other sneaky issues that could be wrecking your sex drive, even men's sex drive. For example, do you want to go through them?
I'm all ears.
Low iron. When was the last time you had your iron checked? Vitamin D deficiency. Half of all U.S. adults are deficient in vitamin D. Adrenal fatigue, I don't understand that one very much. It has to do with higher levels of the stress hormone cortisol. You'll have to explain that. Low thyroid, it can impair female sexual function, including desire, arousal, lubrication, orgasm, satisfaction, and pain. And then there's a leptin resistance. It lowers testosterone levels.
Right. You'll probably have to look that stuff up because leptin is one of these hormones that get released by fat after you eat and can lower your testosterone, and it's part of this mix. And speaking of mixes, the last show, of course, we did a tribute to mothers for Mother's Day, and of course, since our last show, Father's Day has come. And so I want to give a shout out and a tribute to my father, the late great Andrew Benyo, who of course was the proprietor of Andy's Market at 10th and Locust when Hazelton was younger. And here you can see him with his crew. Some of them you may recognize. And it sort of taught me a good work ethic and how to serve people and how to keep people happy.
You worked a lot there, didn't you?
We worked, as my father, we would go in at 6 and we'd leave at 6. And people would say, geez, you know, Andy, that's 12 hours. It's a long day. And my father would say, listen, 12 hours, that's just half a day. So that was the mentality we grew up in. So we still maintain it. So thanks, Dad, for everything. I wouldn't be where I am today without you.
Okay.
And on that note, you would not be where you are today unless you were checking in on Channel 13. Remember to check with our sponsors and try to utilize their services. It's a pleasure coming into your home to hopefully inform and entertain you. Remember, it's your health.
And I love when people stop me and say they saw the show. I love that.
I love that too. All right, sweetheart, good job. Let's go get some broccoli.
Okay.